Now moving to the next, orthopedic. I always like when this light is shown. Alright, so we'll move to the next orthopedics stuff we should be discussing, and this is what synovitis. So synovitis is what inflammation of the synovium, which is like the lining around the joint that helps to make everything to be smooth around it. So this synovium could actually get inflamed, and for this inflammation is not an ordinary one, it's a chronic one. So it's an inflammation that has been there for a very long time. So it just refers to persistent inflammation of the synovial membrane, which is the lining of joints, tendons, sheaths, and bursae. So unlike the acute synovitis, the chronic one has been there for a very long time. Okay, shows you that what even to treat it will cause you a lot of issues, because the disease has basically established a lot of roots. So pathophysiology so that the synovial membrane becomes thick and hypervascular. Okay, and see. So inflammatory cells will infiltrate, produce excessive synovial fluid, chronic irritation. So there will be a lot of pain, there will be a lot of swelling, there will be a lot of stiffness. So causes, different things causing it. Could be inflammatory arthritis, could be different types of infections you have, could be due to trauma, all those direct, mechanical injuries. Could be crystal arthropathies, where you're having deposition of all those crystals in joints. Could be hemophilia, where somebody is easily bleeding, so this person could actually bleed right into the joints. Could be the pigmented velonodular synovitis. So clinical features is there's a lot of joint pains, and the joint is big, it's swollen up. Okay, pain and stiffness, reduced range of motion. Of course, you're not using that joint like you used to use before, and if you try to feel the temperature of the joint outside, there is warm because of the intense activities inside. So you could also have deformities. Alright, synovitis. So you diagnose it from trying to measure some things that their levels usually used to shoot up if there's an inflammation in the body. Erythrocyte sedimentation rate, C-reactive proteins, okay, and all of that. Images. So you can also image, where you do all those, X-rays, MRIs, ultrasound, synovial fluid analysis, okay, and also biopsy. Okay, so that's for chronic synovitis.